every single one of us, every single day, sees somebody in crisis, whether it's a mental health crisis, a drug crisis, a poverty crisis, a homeless crisis, a co-occurring crisis. And we all have to take our own responsibility in that space and figure out how we can be an observer with a report or somebody that can engage. We have a very robust health system here in Marion County that anybody can call. But if you're somebody who's navigating any type of a crisis, you can call either our Psychiatric Crisis Center, which will be rebranded in 2025 to the Behavioral Health Crisis Center, and ask for help. You can look up the Marion County Health Department and you can call a phone number, choose one, there's many, and they'll route you to the avenue that meets the path that you're on, and help people reduce the stigma of substance use. A lot of what we're dealing with in our community is substance use driven. And it seems to draw a shameful stigma because people don't want to talk about it. They don't, whether they're the user or a family of a user. And we want to draw that out because the only way we can solve this problem is together and with people who are brave enough to step forward and make the call. And it's either calling non-emergency, because not everything is a 911 emergency. Every time we see a circumstance happening in our community that's unhealthy, calling the non-emergency number is helpful to law enforcement and to us because we can collect data. We use that dispatch system of data collection to be able to address funds to a particular need. If we don't know it exists, we can't address it. So as people get frustrated, and I'm one of those people who has been very frustrated for some time, I now know that I need to say something, because if I don't say something, nothing happens.